We're also going to give her an injection with epi 1 to 100,000, and that's mixed 50-50 with 1/4% Marcaine plain. And we also put in a cc of bicarb for every 9 cc's of that mixture in order to decrease the amount of burning the patient gets when we give the injection. I'm going to use a 25 gauge needle for the injection of local. And we also use a vibratory device on the proximal palm as distraction anesthesia. I like to give this injection under ultrasound guidance, but the initial part of the injection I'll give without ultrasound guidance. I like to get some of this medication directly in the tendon sheath. Now you're going to feel a little pinch and a burn. We're going to go directly down perpendicular to the skin and raise a wheel and go very slowly here with our injection. You want that wheel of local anesthetic to always precede your needle tip so that you don't hurt the patient while you're injecting it. And the bicarb really does help in terms of reducing the amount of burning that they get from the local anesthetic injection. So we're going to stop there for a second, and I'd like to just check under ultrasound whether or not my needle is going in the tendon sheath. I always like to inject into the tendon sheath with the local anesthetic. It helps the medication track back towards the palm. It also fills up the tendon sheath and kind of hydrodissects within the tendon sheath, and I think that makes it easier to get the instrument within the tendon sheath. So I'm going to look for my needle as I go distal, and you can see her little retinacular cyst there, and you see the tip of my needle go into the tendon sheath. And I'm going to start to inject, and that you can see the medication going back and following a trajectory. Can you feel that?
Yes, I do.
Ooh, go slow.
Breathe for me. No holding your breath.
Okay, and that's it. Now we're going to give that medication about 15 to 30 minutes to take effect, and that essentially decreases the amount of bleeding that we'll have because of the epinephrine which is contained in the injection. We do this procedure without a tourniquet, so it's important to decrease the amount of bleeding. We just do it through a little puncture incision. I'll draw out the incision while we're waiting for that to take effect.